poem about education and dance.
Parents, 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 take us to school so that we may explain our dream and talent of becoming
Teacher,
nurse, lawyer,
minister,
and why not president? Through education, people get job opportunity in the world. People get job opportunity in the world.
Jurnyo bure kone, jurnyo bure kone, jurnyo bure nyawe, jurnyo bure nyawe, jurnyo bure kone, jurnyo bure kone, jurnyo bure nyawe, jurnyo bure nyawe.
Ibule sakit wale yada nas bolok gito bilena dawaya yala kan zol de la jusin ma bag de ligo gurusa dawaya tat bolok de.
This village is just closer to the city. So maybe even for the coming years, all the place will be city. So people even now, they don't know what to do. And most of them, like their youth, which that's supposed to support them, most of them they kill. Because there is a time just some people come with the guns and attack them.
Thank you for coming.
Thanks a lot.
Okay.
Thank you,
Okay.
sir.
Of course, we have a very difficult situation in South Sudan today. South Sudan has been in war for almost 50 years. So you will see that this protracted war has had a devastating effect on the health system. Over 90% of our population live in rural areas. But that means now, if most of the health care services are in the towns, there is a problem. And it is for this reason that the Ministry of Health and the government of South Sudan puts a special emphasis on the engagement and involvement of community health workers.
If the community which is inside the city they're suffering, what about the others community who are outside the city? Can you see we have only 10 kilometers from here to Juba, but you see how community are living. And for them, they were not suffering. When I left this community, we have cows, we have goats, and our people they're cultivating in our village. People were living peacefully, but when I come back, I found even most of the people, some of them they attacked and they took the kids, and the young one they took them, and some of them they have been killed.
Never. The husband died when she's 6 months pregnant. It was in this crisis in Melaka. It's now 6 months. Yeah.
The baby never saw her father.
Yeah, never saw the father. It's a very difficult situation. That is the third baby. Then that one come after this baby. Now the baby is not even speaking. He can hear but not speaking, and even not walking. It's just like that.
South Sudan has the highest mortality rates for maternal and infant mortality rate as well. So in order to reduce this maternal mortality and infant child mortality rates, we have to deal with the community. BRAC has very important interventions in the country, and they have more than 2,500 community health workers.
When I first visited South Sudan with the president of Breton University a couple of years ago and developed this idea for a health project in South Sudan, it was a natural connection to reach out to BRAC because they'd established their health worker model there. They've trained over 2,000 health workers, and they were thinking about these social enterprise approaches to supporting health workers. So we had initial conversations, and it made a lot of sense that BRAC would be the key local implementing partner in South Sudan and also in the other countries in Africa where BRAC operates. We could bring, as Cape Breton University, knowledge and experience in working in many countries in Africa and background in trying to understand the effectiveness of how an organization works and how a social enterprise business model can work.
We provide this box to all the volunteers for keeping the medicine and some materials. If you sell 500, you will get 200 profit. So this 200 he can expend his family, his children education, because people is give him the thanks, and also he earns some money. Yeah. So then you sustainable our volunteers. Yeah. This is our policy.
Ultimately, the findings that come out of our research and our learning, they will contribute to the Ministry of Health because they're also currently in the process of adapting their policies and trying to figure out what the best way is to structure their community health worker program.
Moyo ketir girizu kasaba de bara ana gi kuro buru fi bede yom dagde bad bakala de ay kan fizol indu bakana to de ana buro buru de kan ita tala min ita ro fi bakana de.
I'm working to give the medicine, like the baby is sick, I will help with amoxicillin and oral when it's up diarrhea. The TB now is big, like the children you see now, 2 children, they are writing in BRAC school, but they have TB. These people, they will know me. Many people, they know me. And this area is big. I cannot cover all. My place is very far. But telephone, they will call me. Even the time when this husband of Agatha sick, the husband sick, they call me in the phone. But during the time when she's sick, I told her, you take to the hospital. She took husband to the hospital. But the other day, I came, I got the husband is passed away.
أنا دكتورة نازي معك دكتورة كون كيفك؟ I'm doing fine زمن طويل. Yeah, إن شاء الله كويسة. Some people came from Canada and they need her contact number. Okay, دكتورة تونغمونو. After we're getting our independence, we need doctors, engineers, lawyers, nurses, all kind of civil servants we need in South Sudan. And I think, and we went through a study, and it took us many years. Myself, it took me 14 years to graduate as a medical doctor. I feel very proud and very privileged to have an opportunity given for me by the movement to go and study. So that's why I'm so committed to serve this country, because I know there are many people couldn't make it. There are many young people did not have a chance or opportunity to go to study and come back home. But I think we have to continue that dream to have a free country, to have all the services we never had.